The topics for discussion, we want to talk about mold, what we do to treat for mold. Okay, so remember, mold it's a barrier to healing. It's an obstacle. And what mold does to you, it's the same thing that it does for kryptonite to Superman. It's like a parasite. It just holds everything down and it doesn't work right. And so mold it's one of those things that can affect some people and it doesn't affect others. And so it's one of those things can be frustrating and stuff for couples because one spouse can be really sensitive to mold and one can be like not affected. I consider mold literally an allergy. You can develop a rash from it. You can develop breathing programs, a lethargy, coughing, stuffy nose. A lot of times you'll see, trying to come out through the skin. So you get itchiness and dry, scaly skin. Sometimes you can get these little bumps that leak fluid. And what happens is the mold, it reproduces these tiny spores that are carried through the air. So when people say, I do something so I don't come in contact with mold. Well, the answer to that is let's put you into a plastic bubble and not have you, have any contact with the outside world. When we breathe in the spores, most people's immune system take care of the spores right away. But on some people, it triggers an allergic reaction and it can produce antibodies. It can produce redness, inflammation, and non-specific symptoms, including skin problems. So if we overload our phase 1 and our phase 2 detox pathways, which is our liver and our kidneys, then the body tries to detox through the skin. So that's why you see a lot of mold problems going through the skin. So the most important way to figure out, well, if this is a problem or not is to do a workup. There can be input from, your environment. It's a wet, moist environment. They can do some specific, meaning me, can do some allergy-specific immunoglobulin tests, determine if you're responding to mold. We can do what's called a skin prick test, where you can do, a whole bunch of different allergic reactions. I like specifically to do a urinary mold test. And what I like about the urinary mold test is it really is helpful to get the poisons and toxins and stuff out, identify what they are. Usually it's what they call OTA. So it's an ochratoxin. There can be aspergillosis. And anyway, there's a really neat kit. We can order it. We can send it right to your house. There is different ways to get it. My favorite way is to do a urine test. And when we do the urine test, what we want to see is we want to not see anything. Like we don't want to see any, antibodies or inflammation or anything like that. But if there is, we can literally see it through the urine. And so when I go through and we look at, I'll see if I can bring up an example here, is looking at the mold, what they call mycotox test. And what it does is it looks for aflatoxins, ochratoxin, which I think is the most common one, this toxin. And what it does is it's a specific way that we can look to see, is your body challenging and struggling with molds. It tests for about 40 different molds across 11 mycotoxins. And so if you're exposed to it and you're reacting to it, then we know what we're dealing with. And so these are the type of patients that respond to a mycotox test or should have a mycotox test. So patients, chronic fatigue, headache, sinusitis, respiratory problems, neurologic symptoms, cognitive impairment, immune dysfunction, that not responding to things like we should make sure that it's not a mold. People that are living or work in an environment with mold contamination, like water damaged buildings, if you've had a bad bathroom and you've got black mold in it, are prime candidates. Unexplained illness, immune system problems. I see a lot of food sensitivities and food toxicity to people that have mold tests, and the people that have asthma, chronic sinus infections are mycotoxins. And so we want to look at what type of toxin, and then we want to look at exposure levels. And then what it does is it helps to identify health issues. We can monitor treatments, and we can have, there's a specific, literally a way to help identify, okay, which mold and toxins do we go after? Now, with that being said, well, how do you treat mold? Okay, so the best way to treat mold is, if at all possible, we want to get out of that environment. And what that means by getting out of the environment, if there is something in your house, a leaky bathroom, if there was, there's mold up in the corners or it's under the carpets, like, the best thing is to get it out, get it cleaned up. Some people that I've helped to move apartments and rentals because I think it's that toxic to their health. And then there are a couple different medical treatments. When I say medical treatment, treatments that we have at the office that I really like for mold. Probably my favorite one is something called mycoside. Now, what mycoside is it's a mold killer. It's a herbal medicine, has some lomatium in it, and I think has some Spanish black radish and some other things in it. It's anyway, mycocide, mycoside. That's one of my favorite things to kill mold. And then the things to bind up with mold, I really like something called pectisol. And pectisol literally helps to bind up with mold toxins. There's also I like N-acetylcysteine, and then I love there's a homeopathic called toxic fungi mold nosode. And it really helps your body to train it to get rid of mold. Now, of course, that goes on top of making sure that we are helping with IV vitamin C, dilute hydrogen peroxide. In advanced cases, sometimes, Veronica or Shelby will prescribe, an antihistamine, or sometimes they'll look at antifungal. But for the most part, we're really trying to help those to stay away from the prescription pathway. I've seen some really good outcomes with oregano oil and tea tree oil. And I just really think it's important to be aware, if you stalled out on healthcare, and if you're not moving, then we really need to make sure that that we can get that stuff out of the system. And so, again, coughing, wheezy, nose stuffiness, skin rashes, and then looking at getting it out of your house. And when people are saying, well, what should I be looking for? Dark spots or crusties, a musty smell. If you do decide to clean it up yourself, it's important to wear protective gear, mask, gloves, goggles, rubber boots. You want really good ventilation. You want to sort and discard anything that's been, touched by mold. I really think that you need to clean it aggressively, or even better, replace it. That may not be possible on certain things, but we got to be looking at old books and newspapers and wood. If there's carpet in the bathrooms, kitchen, and basements, these are mold traps. Leaks from pipes or groundwater, we want to clean, and fix as soon as possible. And sometimes people just try and paint over the mold, and you don't want to do that. That's just delaying it just a little bit. But looking at ways to get rid of it, again, mycoside, pectisol, Zymex 2 is a really good consideration. Those are all good things to get rid of mold. Mold is such a poisoner of the system. And again, the easiest way to test it is to do a urinary mold test. I can send it right to your house. Literally, you can pee on a strip. There's kits and stuff that you can look at and buy and see if that's in your environment, if it's not in you. And then if there is someone in your inner circle that has been plagued by mold, and you're not having any symptoms, count yourself lucky, but it can be a serious factor in mold.